Okay, so in this video we're going to talk about the markings of the arm bones. So let's start with the clavicle. So the clavicle is located anteriorly, and it's one of the bones that is really easy to fracture at some point because it's not very strong. So within the clavicle we have a middle end or sternal end, and then we have a lateral end. How can you tell the difference between the medial and the lateral? Well, this lateral, it has this end, it has this convexity. And this one, the external end, is more blunt. And then it has an italic S shape, which is this. And then within the lateral portion and in the inferior view, you have the conoid tubercle, which is this prominent portion in here, just next to the lateral end. So again, medial end, lateral end, and conoid tubercle. These are the only features of the clavicle. Now, we have here the scapula, which is sometimes called the wing blade. And the scapula is located here posteriorly. It has almost a triangular shape with a superior portion and inferior portion. So this will be called superior border, this will be inferior border, lateral border, and medial border. The lateral border is easy to tell because it has this cavity that is called the glenoid cavity. And how can you tell what is anterior, what is posterior? Well, the anterior surface is concave and is smooth, and the posterior surface, it's a little bit convex and it has this projection. This is called the spine, and you can feel it if you touch a little bit below your shoulder and your back like this. That part, that rough part that you feel, that's the spine. So then within these borders we have the angle. So this is superior angle, superior angle, inferior angle, lateral angle. And this smooth surface within the anterior view is called the subscapular fossa. And then above the subscapular fossa we have the suprascapular notch. So several nerves that goes and innervate part of our superior muscles of our trunk, and also the shoulder muscles pass through here. And here in the lateral border, superiorly, we have the glenoid cavity, and then we have this couple of projections. So this is the coracoid process, or bird's beak, coracoid. And then in the posterior view, you have the spine that ends in this broadened projection that is called the acromion. And then above the spine, we have the supraspinous fossa, and below the spine, this is the infraspinous fossa. So supraspinatus and infraspinatus muscles connect into here or insert into here, and in here we have the insertion of the subscapularis muscle. So this is the scapula. Now the scapula with this glenoid cavity articulates with the head of the humerus, which is this. So they will make the glenohumeral joint. So this is our arm bone. So this is the humerus. So the humerus, it has a rounded projection on the proximal portion. So this is the area that connects to the body, to the trunk. So this is the head of the humerus. And then just around the head of the humerus, we have the anatomical neck. This region, closer to the diaphysis or shaft, this is the surgical neck. So when someone breaks their their humerus, they tend to perform the surgery around this area. So that's why this is called the surgical neck. Now, this two projections that you can see laterally, so this is the lateral portion of the humerus, are called the greater tubercle and the lesser tubercle. And in these tubercles, some muscles attach, and in between these tubercles, we have the intertubercular sulcus. So this is a groove or an indentation that allows the sliding of the superior tendon of the biceps brachii. The biceps brachii is this muscle that helps us to flex our forearm against our arm. So there is this tendon of this biceps that slides into here, into the intertubercular sulcus. Now this is then the body or shaft of the humerus, and then within the body or shaft we have this lateral roughened surface superiorly that is called the deltoid tuberosity. So our shoulder muscle, the deltoid, inserts into the deltoid tuberosity. And then we have a groove that runs like this in the shaft. This is the radial groove. So the radial nerve, one that allows us to basically flex some of the muscles of our wrist, or sorry, of our forearm, runs in through here, just by the body of the femur or the shaft. At some point, many of the nerves and blood vessels that are important will run deep next to the shaft or body of long bones. Why? Because it's for protection. So the radial nerve, since it's very important, runs in the radial groove. And then here in the distal features of the humerus. So this is the anterior view, and in the anterior view, medially, you can see this capitulum. This is rounded, this rounded projection. This will be the capitulum, and then this will be the trochlear notch, and then above the trochlear notch, we have the coronoid fossa, and then in here we will have above the capitulum the radial fossa, and this lateral pointed projection, this will be the medial epicondyle, what this will be the lateral epicondyle. So the capitulum, if I said it wrong before, the capitulum is lateral, and then the trochlea is medial, and then here above the trochlea we have the coronoid fossa, and above the capitulum we have the radial fossa. So these condyles, you can feel them on the sides of your elbow, and sometimes if you have hit your medial epicondyle, you have felt some pain in here that sometimes they call it funny bone, but it's not funny. It's because here in between the trochlea and the medial epicondyle we have a groove where the ulnar nerve runs into. The ulnar nerve provides innervation into this ulnar area, so you can have sensation in the ulnar side of your forearm. So when you hit this medial epicondyle, you are compressing your ulnar nerve, and then you feel that pain. Now in the anterior view, you can see again the trochlea, and then this is the olecranon fossa. So the olecranon fossa allows the fitting of the olecranon process of the ulna, which is this, so that you can stop the extension of the forearm up to there. And then the coronoid fossa, which is this, fits into the coronoid process, which is this, fits into the coronoid fossa, which is this. So you can stop your flexion into there. And then the trochlear notch, which is this notch in the ulna, allows the sliding of the ulna over the trochlea in the humerus. And then the head of the radius, which is this is the radius, has this concavity that fits into the convexity of the capitulum, and the radial fossa helps to stop the flexion of the radius over the humerus. Okay, now for the radius. So the radius is lateral in the anatomical position. The pollex represents the antenna of a radio, for those of you who know what's a radio. But this is the head, is proximal. Then this is the neck. This is the radial tuberosity. And here, this is the shaft. This is the head. And this is the scaphoid process. And in here, just next to the scaphoid process, we have this indentation. So this is the ulnar notch that articulates with the head of the ulna, which is this. Now, for the ulna, so the proximal parts. So this is the olecranon process, trochlear notch, coronoid process. And in here, next to the coronoid process, we have the radial notch of the ulna. So the ulna has the radial notch, and the radius has the ulnar notch. And then this radial notch of the ulna fits into the head of the radius, so you can crisscross these bones like this when you are pronating and supinating. Okay, and then this is the head of the ulna, and this is the styloid process. And if you bend a little bit your wrist like that, and you feel here laterally, you can feel the styloid process, and this bump here is the head. Now for the hand, so we have the carpals, the metacarpals, and the phalanges. So for the metacarpals, for the carpal bones, so we have the first proximal, or the first row, which is made out of 4 bones, the proximal row, and this will be the distal row. So this is the scaphoid, lunate, trichetum, and pisiform. Sally left the party. And then to take, coming home will be trapezium, trapezoid, capitate, and hamate. And then for the naming of these metacarpals, the bones of the palm. So we have first, second, third, and fourth, and fifth with Roman numerals, and they have a base that connects to the carpi, and then they have a body, and they have a head that forms the knuckles. And then here, for the pollex, we have only proximal and distal phalange. But for the rest, we have proximal, middle, or medial, and then distal phalanges. And then the finger numbering will go the following way. So first, second, third, fourth, and fifth, from pollex up to the pinky. So pinky is the 5th. This is all. Bye-bye.